Free thinkers, we're free. Here's what we do. We can take some classes, affect the masses. There's no excuse. You've been loosed.
This is From Destruction to Dignity with Janice Pons. Each week, Janice shares her wisdom to enlighten, educate, and advance the culture in America today. Janice Pons is a mother, author, and free thinker, and your host for our podcast this evening. Now let's join your host, Janice Pons.
Greetings, greetings, greetings. Come on in. Come on in. I am so glad that you're here. Welcome, welcome, welcome. My name is Janice Pons. I am the host on this show, on this podcast, From Destruction to Dignity, Clinical Perspectives, Spiritual Truths. Clinical perspectives covers such a wide spectrum of things: behavioral health, mental health, which all falls under health care in terms of clinical perspectives, and spiritual truths. Yes, spiritual truths. One nation under God. Yeah, God, the God factor. One nation under God, indivisible, with liberty and justice for all. Why does that mean so much to me? Because I love this nation. I love my fellow citizens. For I'm proud to be an American. Well, at least I know I'm free. And I won't forget the men who died, who gave that right to me. And I gladly stand up next to you. I'm going to stand next to you and defend her still today. And I'm going to defend you. For there ain't no doubt I love this land. God bless the USA. God blessing the USA. Land of the free, home of the brave. Listen, you know why we're free? Because of the Constitution. Yeah, the Constitution is under a vicious attack, but that is the law of the land. Our flag, our seal, our house on Pennsylvania Avenue, our Capitol Hill, where they are working for us, our fellow citizens. We're flowing together as one. Why? To form a more perfect union. I thank you so much for your support, for the comments that you've been making on these podcasts, on the different platforms. Thank you. Continue to do so. I honestly love your thoughts because we're flowing together as one, as a more perfect union, meaning we are flowing together as one. So if we are one nation under God with liberty and justice for all, should we be concerned about specific segments of our nation that are affected in ways that compromise them? This whole month has been about addiction. We talked about the women who are dying from alcoholism, astronomically higher numbers than ever before. We're concerned about our women. We talked about children. Yeah, we talked about children that end up dying from liquid nicotine. We talked about the marketing strategy of OxyContin and how when people couldn't crush it and snort it anymore, they reverted to heroin, which caused a tremendous uptick in infectious diseases such as hepatitis and HIV. So our precious fellow Americans, they're not operating at their optimal levels if they have these issues going on. So tonight, talking about our precious citizens, let me tell you something. I love babies. They're so precious. And tonight we're going to look at addiction of babies. We're going to look at newborns with opioid withdrawal syndrome. Yes, when they come into this world, taking their first breath, there should not be one of them that is an addict. But the truth of the matter is that there are newborns that when they come into this world out of their mother's womb, we're going to get into the specifics of the presentation that they have. I'm concerned. But there's hope. There's hope. Most babies born to mothers who use opioids during pregnancy are delivered with a form of addiction. These babies are born addicted. And that addiction is called neonatal abstinence syndrome. It's treated in the hospital, but how long the treatment lasts depends on the severity of withdrawal symptoms, which is called neonatal opiate withdrawal syndrome. That's the amount of distress that the newborn is experiencing. Oh my goodness, I have seen people make presentations to me. They were ravaged by addiction, shaken, can't even pick up a pencil, totally lost. Now, speaking of being totally lost, I want you to listen to this. I want to capture how these babies, how they are presenting that it's ravaging. It's ravaging, it's ravaging, it's ravaging. Here's how they come out. Now, everybody has held a baby. I'm thinking. Think about your child, your grandchildren, your nieces, your nephews, your friends. You look at the baby. We just love to hold babies. I love holding babies. They're dependent on us to get it right. So when they come out, I remember my son came out. What you gonna call this boy? That nurse said. Oh, yeah. And the first time I held him, I knew I was having a boy the whole time. Okay. But I knew God told me, you having a boy. He told me before I was pregnant, when you get pregnant, you're going to have a boy. Okay. I had a boy. But I didn't find out till he came out. Okay. He was beautiful. He changed my life. I was a mother. I talked to him. I read to him. I prayed over him in my womb. I ministered to him in my womb. And when he came out, I continued what I had already started. But when that baby comes out, and that baby presents this way, shaking with tremors, excessive crying. Visualize this as we go now. I'm a very visual person. Anybody knows Janice Pond's real good that are friends with me is, girl, you so visual. Yeah, I am. Because I've seen a lot. Okay, so shaking with tremors, excessive crying. I'm very observant. Yeah, I'm trained. That's my bent. I'm trained that way too. Tremors, excessive crying, fussiness, fever, diarrhea, seizures, can't sleep, poor feeding, and having problems with breathing. Visualize it. I want us to get a picture of that tonight. These are our fellow Americans. We've been talking about addiction, but we got to go there, guys, because we got to know what we're dealing with. How are we going to tackle an issue if we don't even know what's going on? Tremors, excessive crying, fussiness, fever, diarrhea, seizures, trouble sleeping, poor feeding, and breathing problems. That's how they are presenting. So, Dr. Leslie Young, a medical doctor of the University of Vermont Larner College of Medicine, led a study. The title of Dr. Young's study was called Eat, Sleep, Console. Eat, Sleep, Console. The Eat, Sleep, Console approach to taking care of newborns was how they treated neonatal opioid withdrawal syndrome. Now, the Eat, Sleep, Console approach for newborns, listen to this. This really got my attention. My clinical mind started going, whoa, listen. The Eat, Sleep, Console approach for newborns with neonatal opiate withdrawal syndrome reduced the average time in the hospital by 45% compared to the usual care, which typically included morphine. Morphine for the little newborns. All those symptoms that I just described, those nine different symptoms that comprise that presentation, that they come out addicted, a newborn addict, a newborn is an addict. They normally have been treating it with morphine, but Dr. Young, their approach was Eat, Sleep, Console. It was not a direct comparison that they did, but they did an analysis of time to discharge. That was their measure. An analysis of discharge yielded by a standard withdrawal severity assessment tool. I use those kind of tools all the time. You got to have a standardized tool. You got to have it measured. You can't just be flying by the seat of our pants. Okay? So, the discharge time, that's what they were looking at. What were the results of the Eat, Sleep, Console method? Now, this method relies on a function-based assessment of withdrawal severity. Function. How can they function? Can they eat? That's a function. Can they sleep? That's a function. Can they calm down? That's a function. The Eat, Sleep, Console care tool relies on a function-based assessment of withdrawal severity that's focused on an infant's ability to eat, sleep, and be consoled, along with the use of non-pharmacologic interventions, no medicine. Now that's different, especially if they were using morphine. So what did they do? Low stimulation environment? I would imagine they didn't have bright lights. Skin to skin contact. Skin to skin talk. Let me say this about skin to skin. Or touch. 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 Do you know that a study has shown that we're all supposed to get 8 to 10 hugs a day? Everybody's deprived. I would be surprised if husband and wives are even hugging each other that often. Why don't y'all hug each other at least 5 times before y'all leave the house? What may happen? Hug your children. Hold them. Console them. Bring them to you as safety and give them words of affirmation as you're holding them. I'm a hugger. Anybody that's in my circle that I'm close to, now I don't just go hugging anybody. But folk that I know, me and my son, we hug. Come here, Mom. Come here, baby. We hug and we hold. You got to know when to hug her. No. Yeah, you do need to know when to hug her. We need to be hugging. And there are boundaries within that, okay? But people that are close to us, we need to be hugging each other. We need to be affirming each other. And they found that as the non-pharmacologic intervention with these babies who were born addicts. So low stimulation environment, skin to skin contact. They brought skin to skin contact with these precious little newborns. Clustered care. That means there was a cluster of interventions that happened. It might be occupational therapy. It might be physical therapy. It might be touch therapy. It was the all of this cluster. It was concerted. It was specific. It was intentional. And guess what else? Breastfeeding. Let me tell you. I won't spend too much time on breastfeeding. But before I had my son, I was like, ain't no way I'm going to breastfeed. Dad, no. And then God spoke to my heart. And he said, I want you to breastfeed him. It's going to build up his immune system. Go look at online about the advantages of breastfeeding. I cannot begin to tell you the power of that experience of breastfeeding. That was skin to skin contact, and just the comfort that it brings a baby when they begin the suckling process on their mother's breast, and the bonding that takes place. Truly, God was in our midst. I could feel the tangible love of God. I could feel his anointing. I could feel his power. He just talked to me when I was breastfeeding. True story. So, the non-pharmacologic intervention included breastfeeding, clustered care, low stimulation environment, and skin-to-skin contact. That was the first line of treatment. It empowered families. Can you imagine meeting with families and teaching them those types of interventions? Oh boy, you're talking about something going on in the room. Oh yeah. These people get empowered and they learn of a different way to look at it. It's like, baby, yeah, you may have been dealing with opioid dependence while you were pregnant, okay? And it affected the baby. But we're here now, and we're here to do something different. And although your little baby presented with this horrendous presentation that I already gave you the symptoms thereof, there is hope and empowerment for families and caregivers in the care of their infants. There's hope. You just got to give them that intervention. That's why we need anointed treatment teams. Boy, my team I'm on, we roll. I love it. I love showing up at that hospital where I work because everybody's got a psychiatrist, the doctor, the occupational therapist, the speech and language therapist, the certified occupational therapist assistant, the neuropsychologist, the nurse, me as a director of my program, my department of what I do, all these different angles and multimodal disciplines, the nurses, the certified nurse assistants, the mental health techs, all of us come together to make a most dynamic team that intervene and are there for our fellow Americans' health care, and their lives turn around. So what lives are we talking about tonight? Newborns with opioid withdrawal syndrome. Yeah. So Dr. Leslie Young is a neonatologist. These words that have all these syllables, I have to think about it when I'm getting ready to say it. Oh, look at neonatologist. That's what Dr. Young is. And Dr. Young is also the associate professor at the University of Vermont, Larner College of Medicine in Burlington. Listen, we already talked about the presentations that these babies have. Tremors, excessive crying, fussiness, fever, diarrhea, seizures. Can you imagine all that going on at one time? Can't sleep, can't eat, can't breathe, having problems breathing. They are caused by neonatal abstinence syndrome, which is caused by prenatal exposure to opioids, often in the form of medications. I can remember doing a CD, chemical dependence assessment, with a lady one time, and we're sitting there, and I have a protocol that I go through, talking about standardized measures. And I said, ma'am, And I knew that opioids was her problem. And I said, ma'am, how many Lortab do you take a day? And she went, 40. I said, what did you say? 40. Oh, medication. She was addicted. Listen, a lot of times they get pregnant and they're addicted and they don't know they're pregnant. Yeah, they don't know they're pregnant. They can be pregnant for 6 to 8 weeks and they don't know they're pregnant. Oh, wow. You see the implications here for our fellow citizens. Neonatal abstinence syndrome, NAS, is diagnosed every 18 minutes in our country. Do you see how prevalent this thing is? Do you see why we might need to be talking about this? Do you see why we need to be looking out for each other and talking? But guess what? It can be successfully treated soon after birth. Although the infants experience extreme discomfort and distress, it's treatable. It's treatable. Yeah. And this consoling, this skin-to-skin contact, this low stimulation environment, this clustered care, this breastfeeding, this intentional targeting, guess what it results in? This study done by Dr. Young and her colleagues enrolled 1,305 infants. Listen to this, guys. I have hope. I have hope for our country. We just got to be intentional. And we have to identify what's going on and not being like an ostrich with the head in the sand. Well, you know what? No, we got an addiction problem. Let's go there. They found that the number of days with these 1,305 infants, newborns, they found that the number of days from birth until readiness for hospital discharge was 8.2 days for the babies that went through the Eat, Sleep, Console group. And it was 14.9 days in the usual care group. The usual care group were the ones that got morphine. That's a difference of 45%. That's staggering. What kind of implications does that have on Medicaid, Medicare, insurance? See, some people ask me, what do you do? I say, I advocate for people who can't advocate for themselves. So I'm presenting the clinical data to an insurance company, a payer source. And if I can get them to see something like that, I can show them how I can save you money. And then you will have a sound and well patient, even starting from newborns, whole families, where they get that clustered care. And we're very intentional. I love this kind of stuff because I see people's lives turn around. How do you think I felt when I started and ran that program where 87% of the people were clean and sober and gainfully employed 6 months later? And I just told him, I said, look, sir, bottom line, for these 30 days, you got to do what I say do. What do you mean? What I say do? So, because what have you been doing? And what have you done to stop this? And after that, is it working? No. As evidenced by what? Well, they break down. Oh, I love it when men cry. Because I've reached a part of their soul that has not been tapped into. And then they get delivered. They get set free. Because we go to their mind, their will, their emotions, their intellect, their drive, and their desires. I want to know what those are. Because I want to rally with them. I want to embrace it with them. I want to let them know they don't have to go on that journey alone. Give me the opportunity to partner with you and your family and your loved ones. That's how we need to think. That's forming a more perfect union, guys, where we're flowing together as one. I get excited about this stuff, can you tell? The Eat, Sleep, Console approach to babies born addicted to opiates concludes an accompanying editorial that was done by Dr. Wanda Barfield. And you know what she said? I like this. She said, look, this is how it starts off. It offers an innovative opportunity to use a tried and true way to care for babies affected by neonatal opioid withdrawal syndrome. Guess what Dr. Barfield said? We just need to hold them. Hold them. Hold them. Yeah. Console them. Skin to skin contact. And you know what? While we holding each other and holding our children and holding our babies and holding our husbands and our wives and giving our friend a hug if they need it. I did that with someone one time. And God said she needs a hug. And she was so broken. I said, do you need a hug? I need a hug. And she literally sobbed in my arms. But it broke something off of her. Yeah, it broke it off. Yeah, it did. The power of touch. Appropriate touch. Now listen. We got the babies, the newborns that have the opioid withdrawal syndrome, and we also got fetal alcohol syndrome. Let's touch upon that real quick. Because alcohol is a drug. And if you're drinking and you're pregnant, or you might get pregnant, so how do you get pregnant? Huh? So if you're sexually active, you might get pregnant. So may we be considering the choices of ingesting addictive substances? May we? Okay? Because there is no safe amount of alcohol during pregnancy or when you're trying to get pregnant. There is no safe time to drink during pregnancy. Alcohol can cause problems, all kind of problems. This includes wine, it includes beer. There is no safe consumption of alcohol, none whatsoever, and it's never too late to stop. Listen, fetal alcohol syndrome, it causes all kind of issues: low body weight, poor coordination, hyperactive disorder, difficulty with attention, poor memory. This is the presentation that these children are going to have. I've worked with people with fetal alcohol syndrome. They're going to have difficulty in school. They're going to have learning disabilities, speech and language delays, intellectual disabilities. They will have low IQs. They will have poor reasoning and poor judgment, sleep and sucking problems as a baby, vision and hearing problems, problems with the heart, the kidneys, and the bones, shorter than average height, small head sizes, abnormal facial features, that little bridge, smooth ridge between the nose and the upper lip. It's just smooth. It doesn't do like the normal way. That's called the philtrum. It will not be normal. So, fetal alcohol syndrome is a serious issue. Where do we go from here? These little precious babies that are opioid addicted, these precious babies that are born with their moms and they drink the whole time that they're pregnant, their child will end up being addictive. Listen, here's the deal. There are types of treatment options. Medically supervised detox. You got to get sometimes in a 24-hour structured setting. That's why I thrive. I would thrive in those settings. I wanted to get a hold of those people and their lives changed. To God be the glory. So, types of treatment options. There's medication that's involved. Sometimes they have to have a medically supervised detox. Oh, yes, they do. Behavior and education therapy. Parent training. Alternative approaches to approaching your children. No one treatment is right for to every child, but you have to have a treatment plan that's going to include close monitoring, follow-ups, and changes are needed along the way. That means you're not out here being some lone ranger. You're going to get professionals involved. That's wisdom. Then there are protective factors. Listen, if we know that there are risk factors involved, you can get a diagnosis before someone's 6 years of age. Yeah. Loving, nurturing, and stable home environments, having structure. It needs to be predictable. It needs to be planned. We're not flying by the seat of our pants. Violence being absent from their environments. Involvement in special education and social services. Get help. What I'm saying is get help in this great nation. We're one nation under God, indivisible, with liberty. Yes, freedom and justice for all. We want freedom for these newborns. We want freedom for their families, their moms in this great nation. This more perfect union flowing together as one. Our flag, our seal that represents us flowing together. We want to go from destruction to dignity because God wants us free, and he wants us free from addiction. Good night.
Thanks for listening to this week's episode of From Destruction to Dignity with Janice Pons. Janice's mission is to provoke thought, bring awareness, and point people towards intervention when needed. As a reminder, this show is not therapy, but for educational purposes only. For more information, check out JanicePons.com or follow her on social media.
Education, affirmation, dedication, information, revelation. A new nation. We are God empowered. Strength is ours. Liberty, been set free. Education, affirmation, dedication, information, revelation.